Ever notice someone dragging large black bags through the hospital lobby and wonder who they are? That, my friend, is a medical device rep. Welcome to Device Guys. Your hosts, Brent Lloyd and Jason Doliak, bring 50 years of combined medical sales experience to the table, sharing insights, stories, and a behind-the-scenes look at this fascinating world. Enjoy the conversations.
You know, the job as a med device guy, it happens in the room. That's where the rubber meets the road. You're in an operating room, you're in a cath lab, you're in an EP suite, and everyone has different styles, different philosophies. Each lab has different expectations, or each OR. There's a different vibe, right? I think we can agree on that, right?
For sure.
And, I wanted to ask you and have this discussion about kind of what your philosophy is when you're in a case with a team, with a physician and a team and a mapper and a circulating nurse and a scrub and all. Like how do you go about things, and kind of what how do you use that time, and what's expected of you, and just give me an idea how you.
I mean, the first thing I think, and this is what I tell people that are coming and work in my accounts and in the labs with me, is first thing is go in there humbly, because we are guests in this place. We are guests in this place. We've been invited in, and we got to fit into the network of what they're doing there. And so, but the big part is really understanding what you're going in on and be prepared for all eventualities. Like with the product that we bring, we've got leads, we've got generators, we've got sheaths, we've got wrenches, we've got catheters, and we've got all the different tools to get these products into the right place in the heart. And so you better be well prepared for eventualities, that if you have to turn and pivot, you better have what you need to do it, because that patient's already on the table with an open pocket. So your responsibility, our primary responsibility, is have the things that we need. Now, the outcome of the procedure is out of your control, but you need to have everything we have in our control available for them. And that's barrier one. That's, you show up with that, and the knowledge that comes with doing these cases over and over. That's when you really get to contribute. When you get to make suggestions. And I think the times that we make suggestions that are effective are probably, I don't know, 1 out of 50 maybe. Like most of the time, it's you're there, you're having the right stuff, you're delivering the information concisely. You're anticipating. You don't want guys to wait, and that's the thing. There's different labs. I mean, there's guys like that. I know how they operate. I see blood in the needle. I know they're moving. I'm already dropping stuff. Now, there's other hospitals that they want to ask you for everything.
There's some hospitals you don't drop stuff.
Well, and if you're in a new place, you find a circulator and say, hey, how do you guys like to do this? I mean, who drops stuff on the table? Because I mean, in the OR, in the cath lab office, we don't touch anything blue, we don't touch anything sterile. But in there, we can drop if they want us to, or hand off to them. Right. How do you? I mean, so what else on that? What are you thinking?
Yeah, I like what you said about a guest. The job I have early on, there weren't very many of us out there supporting these cases, and we traveled a lot. And there were times where I would go places to help when I didn't have cases in my territory, or I was flying people in to help at my centers. Mm-hmm. And the worst thing would be when I would get the feedback from some of my people of the person that I brought in, who would come in and they were in charge, right? And we're going to do it this way because this is how I do it. I don't care how you do it, which is the exact wrong thing to do. You're tough. A guest, to your point, and you just adapt. Oh, this is how you do it? That's fine with me. Oh, you want it laid out this way? 100% fine. And you just adapt. And I think that's what a good rep does, is identify the situation, ask a lot of questions, be a guest, and stay out of the way.
Stay out of the way.
Right?
Yeah. Speak when you know. If you wonder if you should say something, you probably shouldn't say.
You probably shouldn't. I tell that to my clinicals all the time. If you're thinking, should I say this?
Don't.
That means don't say it.
Don't say it.
Don't say it.
Right. And then, if you don't know, you better tell them you don't know.
Yeah, tell them you don't know.
Tell them you don't know. We're dealing with the smartest people on the planet, and if you don't know the answer and you BS it, they're going to know that.
No, and
There's
then that's
nothing.
you
There's
never get
nothing
that
worse.
chance back.
You never get that chance back.
Right.
Now to say, oh, you know what? I don't know. I don't know, but I'm going to find out in the next 5 minutes, and then you do it. I don't know. It's great.
Right.
Mistakes are fine. Repeated mistakes aren't good.
Yeah, exactly.
Repeated mistakes aren't good.
You know, the other thing, I had a conversation with a doc just earlier this week
No.
about, you know, there's a lot of structural heart reps out there. I mean, we got appendage closure, we're clipping the mitral valve, we've got transcatheter aortic valve replacement, we've got all kinds of stuff going on.
Yeah.
And that's a lot of reps. And, you know, these guys have done thousands of procedures, hundreds at least, right? Sometimes the best thing you do is just shut up, right? Like, if I can do a case and not say one word during the case, that's a good case.
It's a good case.
It's a good case. And I've had docs complain about other reps from other companies that tell them what they're going to do right before they're going to do it. Like every step, and they're constantly talking. And eventually people shut down, they don't listen because you're talking too much. And when you do have something to say, they're already shut down because you've been talking. Like, if you don't talk all the time and you do notice something and you speak up, then they'll pause because they know what you're going to say is useful to them. So be useful.
Right.
Right?
Right. Yeah. I mean, a lot of it is like, I see a lot of the places that we can benefit is we see so many cases. Like, we see so many of everyone's cases that there are times when they're running into a tricky situation in a tricky coronary sinus and be like, you know what? I saw a doc one time try this, try a double wire technique or some thing you can do. And if you can add value, add value. And if not, though, stay out of the way.
Do you find most of the time guys are receptive to that?
Most of the times they are. Yeah, I mean, I haven't been around a long time where someone's really not receptive.
But then you're you too, right? Like, you've been around a long time, they don't trust you. But if you're like the new guy,
if I'm the new guy,
and you come in hot,
yeah, it's probably
it takes a long time.
The best idea. And me, I found, I mean, in transitioning companies in the last 2 years, it was hard going into places where I wasn't well known. They didn't care who I was.
You're Jason Dolan.
Nobody cares. Nobody cares. They didn't care how long I've been doing this. It's like, yeah, whatever.
Right.
Whatever, guy.
Yeah.
Go check that device.
Rep. Go check that device.
Hey, rep.
I think the way that we help on my side of things is, like to your point, we see a ton of cases and we run into a lot of stuff, and it kind of helps us disseminate that across the territory. But there's times when things get super intense. Because, we're working with patients. This used to happen a lot more, early on in this therapy, where we didn't have an indication for patients that were healthy enough to have a surgery. And so they would come in, in late 80s without any reserve, with heart not pumping very well. And, we could get into trouble in these cases where, the doc is thinking about 10 things. Like, blood pressure's dropping, we got to get this valve in. I've got to get a big 24 French sheath in the artery.
Yeah.
And all we have to worry about is the valve. And so at those times, I kind of reset my brain to stop thinking about everything else that's going on in the room and think about this one thing. Make sure the valve is on the right direction. Make sure they do all the steps and they don't miss a step. Make sure we've got our camera in the right view so that we put the valve where we want to put it, and don't let them make a equipment-related mistake.